Hi, this is Tim Bonack from Manual Edge Physiotherapy. I'm a physical therapist and a Canadian trained osteopath, and today we're going to be looking at lower neck flexibility testing. What you will be doing is standing in front of a mirror with your shoulders relaxed. So you don't want your shoulders up here, you want them down and relaxed. If the shoulders are up, it will impede the mobility of the neck and give us a false reading. You want to keep your face straight forward, so you don't want to allow it to turn in either direction. The test is bending the head and neck to one side and noting the mobility and what it feels like, and then bending your head and neck to the other side and noting the mobility and what it feels like. Again, keeping your face straight ahead. When you do that maneuver, you'll see that the top of the head and the chin move in the same direction, to the same side. We should have approximately 40 degrees of movement to one side and then the other side. That would be considered approximately normal. You want to compare each side in terms of, is there tightness and discomfort, as well as does your neck move to one side better than the other. The second test for lower neck flexibility is basically the same movement pattern, but we're going to introduce a towel. So this is basically just a medium hand towel. We're going to put it over the shoulder in the crook of the neck. So it's got to be way up in the crook of the neck. It can't be out here. Okay, so in the crook of the neck, I've got one hand in the front and I've got one hand behind. I'm going to just come up a little bit. And you can see that I am stabilizing my shoulder. So what I'm doing is I'm pulling with both hands my shoulder down. Sometimes there's a tendency for people to elevate the shoulder as they pull down. Well, we don't want to do that. We want to keep the shoulder down as you're pulling down with both hands. That will fully stabilize the shoulder. So then what you're going to be doing is the same movement as the other side. Keeping the face straight forward, we're going to bend to one side and then bend to the other side. And then you'll repeat on the opposite side. Again, the top of the head and the chin move to each side. Okay, so we're looking at mobility to each side as you stabilize the shoulder. Again, you should have approximately 40 degrees of motion, and they should feel loose in terms of the area here when you go to each side. So I hope that helps. Thanks. Bye-bye.